CRA's work around dealing with inequalities and how to think and rethink how we share revenue as a country comes in very handy. The policy makers are in government. So this year we've tried as much to bring in those policy makers into the room so that they can also, be part of the discussion, but at the same time they can get to hear some of the challenges that county governments are having, but at the same time to try and connect it with how can government policy start responding to those gaps.
Article 203 of the Constitution mandates the Commission of Revenue Allocation to develop a criteria for equitable allocation of revenue to the two levels of government.
Is revenue shared equitably between the two levels of government? This is maybe something that a lot of people don't know, how revenue is shared between the two levels of government, and this is the work we do. The government estimates to correct 1.6 trillion shillings, close to 1.7 trillion shillings, where the county's governments get 314 billion among the 47 of them, and the national government keeps 1.3 trillion for the national functions. And in the principles of devolution, ideally, funding should follow function. Ensure that the functions that the national government keeps are fully funded, and the functions that county governments undertake are also fully funded. So that really is the basis of devolution. So in total, what the county governments have got since the onset of devolution is 1.5 trillion shillings among the 47 of them. Formula has been used over the last 6 years. So we are now operating on the second formula. In the formula, I can first talk about the way it is structured. The formula has 6 parameters. The money is allocated based on how the population, the number of people in a county, the levels of poverty, the poverty depth. How far away is the population in the county away from the poverty line? It also allocates money for land area, and that is 8% of the kitty, 45% on population, 18% of poverty. Then we have what we call the fiscal responsibility parameter. This takes 2% in that formula, and the idea here was to try to incentivize counties to correct all the revenues that they could. So a county that corrects more year on year benefits from that 2%. So from the equitable share, this is what the counties in the North Rift region have received over the last 6 years of devolution. I'll start with Uasin Gishu, has received 31 billion. Trans Nzoia has received 30 billion. Nandi County has received 28 billion. Baringo 26, West Pokot 26, and Elgeyo Marakwet 19 billion shillings. When you take the poverty factor, or the poverty parameter in the equitable share, this is how the counties in this region have received money. So West Pokot, because that is the one where the experiences the poverty in the most severe way, then West Pokot from the poverty parameter, they've so far received 5.2 billion shillings. Trans Nzoia, the second, has received 4.9 billion shillings. Baringo, 4.7 billion shillings. Uasin Gishu, 4.3. Nandi, 4.1. And Elgeyo Marakwet, 2.7. So again, going to the principle of equity is making sure that people get what they need, not that they get the same amount.
The main challenge we are facing, if you look at the current formula that is being used, one, the base factor is the revenues that we are facing, our resources or allocations that goes to county governments are based on the audited accounts of 2013. Remember, since that time, the total revenue collected nationally were below $1 billion. But as we are talking now, it's more than 1.5 billion.
The Constitution said, base it on last audited and approved accounts. This gives Parliament a leeway not to approve audited accounts.
A case in point is RMLF. That's a road maintenance levy fund. We have in cases where some particular road can be given funding by the county government and the national government because we are not able to really read from the same script. Another issue that we are facing is when we are using some statistics which are outdated At the moment, I think we're using 2009 Kenya National Bureau of Statistics census results. Otherwise, if we rely on these old statistics, where you are told Baringo has a population of 555,000 people, yet most of us have worked hard to marry 3, 4, 5 wives, you're actually lying to us, because we've really improved in terms of expanding the population in the county.
Costings or functions. In Uasin Gishu, we have a unique situation where we have 4 former local authorities: Uasin Gishu Municipality Council, Ban Forest Town Council, Wareng Town Council, and Taribo Town Council. Those authorities, the staff that were employed in those authorities, they take 47% of the personal emoluments.
For example, a function like L, we only have 1 staff in every dispensary. You cannot take that staff who was doing, who was working in a town council to go and work in a dispensary, because you need to employ an health staff to work in a dispensary. So you'll realize that most of us, we are challenged. We cannot employ qualified staff who are supposed to provide services to our people, and yet we are still paying people who don't add any value to the counties.
These counties, I think we are putting them into more pressure to overtax the already taxed population. Because you tell them this is your target, or maybe they say this is our target, we want to raise, they go down to the people to tax them from the chicken and everything, so that CRA will appreciate them.
Lazima CRA ifanye actual costing. Hawakufanya actual costing kujua ni fedha ngapi zinahitajika kuweza kutoa huduma fulani. Kwa mfano, ukitengeneza barabara ama kuweka project ya maji, families ambazo wako katika Kerio Valley, maybe unaweza enda kilomita 1 ndio uweze kukutanisha 2 families. Na hiyo fedha ukisema per head ni karibu 10,000 shillings. Uwezi chukua 20,000 na uweze kuwatengenezea project ya maji. Ilali sehemu kama Nairobi ama urban areas, ukiweka pipe moja ya maji labda inaweza serve watu zaidi ya 10 ama 20. Lakini kwetu unahitaji pipes 100 ndio uweze kuserve 2 families. Na hiyo pia lazima uangalie.
We actually raised some concern. I'll just mention it in point form. One was allocation of funding on ward level. Another one was poverty, especially for the squatters. We also have land historical injustice. Road network also is still a problem. There was also another case on
make it the last one.
Access to education.
Revenue allocation. You find that it is very difficult for the local mwananchi to understand and to participate. What is it that the Commission is doing to bring this knowledge clearly in the mind of the local people to understand their right when it comes to revenue allocation? Because our people are still using those old mentality that even the revenue that is allocated to a ward is being misused by those people who are in position.
In Elgeyo Marakwet, we have a formula or an act called Equitable Development Act, which takes 60% of development money to all the wards. And I think looking at Elgeyo Marakwet in terms of what we receive from CRA, if we could just sit at the county level and allocate these funds, maybe we could be having a lot of problems now in our county. And one of the things that we did was to do a lot of civic education and public participation so that the people are aware about the money which comes to the county, what goes where, and then now involve them in deciding which projects. And again, it's not only that we involve them in choosing projects, because first of all, what county does is to develop a CIDP. So that CIDP will be the guideline so that when a certain ward are allocating resources to projects, they must pick projects from the CIDP. And I think for now, all the counties have developed the 2017-2022 CIDP.
The criteria looks very okay. I have no problem with it. But it doesn't get developed to the county level. If you choose a ward in Elgeyo Marakwet that is, you have said this is very disadvantaged ward, how do you come and make sure that money reaches there? Most of the counties don't have enough money even to pay salaries. So that criteria becomes useless as soon as it reaches the county, because the priority is to pay salaries.
We want to clarify that governors have budgeting discretion, and the commission cannot take that away from them. Otherwise, we shall be told you are unconstitutional. Ours is a revenue sharing formula. And once we finish sharing, the mandate lies with the governor, and that is why you, the citizens, must now sit together with the governor and his administration and tell him how to use the money.
Kindly, I needed to make one question to CRA. Do you have any monitoring system towards the allocation of the funds from the county to the ward, or some few cartels benefits from the same allocation that you give to those people?
We don't have a monitoring system because we have different commissions and we have different independent offices. Controller of budget is more or less the office that tracks the budgets, and they have quarterly reports. That said, we do have a mandate to ensure the funds are well used, that Kenyans are getting value for money.
In demographic studies, places that are civilized, that is where people are rushing to. Places that are having hardships, that is where people are running away from. So if you use a population kind of criteria and give it more weighted factorial loading to your consideration, then you are creating a bigger problem than you will be solving it.
Principles of devolution is that finance should follow function. The money a county gets is to discharge the functions that a county is given. And which functions are county given? It is to deliver health care, it is to provide services in agriculture, in water, to do roads, class D and below, and a few other functions. So the question you want to ask yourself is, if finance follows function, what is a good proxy measure for health service needs? What is a good measure for the needs for health? What is a good measure for the needs for agriculture? What is a good measure for roads development and maintenance? And that is why the commission decided, in the absence of a very good estimate of what it costs to deliver health, let's use population, because that tells you how many people demand health care. That tells you how many children need immunization. It's not perfect, it's not good, but it is an estimate of the cost of service delivery. And it takes 45%. But out of 45%, what is the balance? There's another 55%. 55%, if you look at the other indicators in the 55%, they're supposed to make sure now that the counties can now, those that are lagging, can invest and look as nice or catch up with the others.
There's another aspect of poverty index. We on and on, we've been trying to raise to CRA to look at this. As one, either that we need to look at a way of increasing the equalization fund, and increasing this equalization fund, we need to look at the approach and the structure of this equalization fund, so that we're able to identify the regions that are actually need the equalization fund. The current setup, we are basing on counties, and we've classed some counties as though they don't qualify, just by virtue of certain percentage of their population are deemed or are perceived to be in a well-off, wealth-wise.
The issue of urban poverty, it is happening in the old towns, but I can bet you in Iten now, we are developing those low-income estates. In West Pokot, we are developing those low-income estates. So how do we have a plan so that before those low-income estates come up and become a problem after 5 years, we resolve that and have a plan in advance to resolve that problem, so that we grow with a plan in mind.
Poverty is then supposed to take care of the development gaps. And here we don't take the head count index, we take poverty depth. We ask, how far away is the population from the poverty line? How deep is the poverty? So even if one county has 300 poor people and another one with 300 poor people, you may have one that are so deep in poverty, it will take a lot more resources to bring them to the poverty level.
Ile equitable share ambaye inatakikana ipelekwe kwa county iongezwe kutoka 26%. Najua kama Elgeyo Marakwet propose kwamba iende 50%. Nimeona Uasin Gishu pia wana propose iende hiyo 50%, lakini at least iwe percentage ambayo inaweza wezesha counties waweze kumeet their daily operation costs.
So for the basic equal share, the commission was estimating how much a governor needs to run his office. It is not a measure for need of past service delivery. It is asking how much does Governor Tolgos need to run his office, pay his cabinet, and pay the few other workers. And that is why we as a commission have a problem with increasing that amount, because it is not based on a function. It is based on the administrative cost of a county. And what we had said, making basic equal share 26%, is that regardless of the size of your county, you still have the same size of a cabinet. Uasin Gishu and Elgeyo Marakwet will have the same number of CECs. They need county offices, they need a county assembly, they need to pay the MCAs. That is what we're putting in the basic equal share.
Can we adopt a manner or a formula whereby we're able to identify right from the ground areas that requires equalization fund? Because today, if you give me a small envelope, I'm just going to distribute equitably in a manner that every region of the county will be able to feel it. But there are some other levels of county areas and regions that requires further attention to look at the education aspect, to look at the food stability of food supply to them, health matters, even roads alone, infrastructure in that place is still poor, just because of their geographical region. That if I decide today to allocate enough resource, I will deny the other region, and it will not be in order.
Equalization fund, it shares 0.5% of the last audited and approved revenues. So since 2016-17, the amount that is going annually to that kitty is 4.6 billion until the day Parliament will approve the accounts. So the first policy, which lapsed last year, used 3 approaches. Constructed a development index, looked at the historical injustices report, then asked people who do you think is marginalized, and then put these three together. And then they said, any county that appears in 2 of these variables then qualifies to be marginalized. So we agreed that we'll construct an index at the lowest level possible. And the index consisted of the following: access to safe drinking water, use of improved sanitation, household use of electricity, primary school attendance rate, and secondary school attendance rate. So using these 5 factors, we constructed what we call a marginalization index and ranked all the sublocations in Kenya from the worst to the best. But remember, we have the index of marginalization, which also measures the depth of marginalization. So sublocation number 1 is much more marginalized than sublocation number 1,400. So we then, based on that consultation, identified the 1,424, and this covers about 5 million Kenyans. We felt we want to make sure you can tackle marginalization at its very depth and make sure you are lifting everyone up. So in our view, we didn't take money away from the original 14, they're keeping 80%, but we're also taking care of other Kenyans who are equally in need of these, to access, or at least to have their lives uplifted. This is what the Commission has interpreted or is doing about equity, ensuring there is equity in the country over the last 6 years. And we believe that if we can work together, we can go very far.
And from that basket or envelope that we are given, the functions are enormous, functions are much, and we can appreciate that wananchi feels more service of a county government, and therefore they have shifted the expectation more to the governor than the national government.
For us to take devolution to the next level,
they need to break poverty below the county. They need to give us poverty numbers at the ward level. That way, we'll be able to ensure that when counties are allocating their budgets, we'll be able to ask, is this budget pro-poor? Is it taking care of the depths of the areas of the wards where there are depths of poverty? But at the moment, because poverty is given at the county level, we are not able to break it down below. And it is important going forward to make sure there is no marginalization within the county, to make sure there is equitable distribution of resources within the county itself. And we can only do that if we have poverty numbers below the county. So I think that is going to be important for us going forward.